manufacturer. It's a manufacturing powerhouse that produces proteins, regulates cholesterol and hormones, and stores several things, glycogen, vitamins, and minerals. Again, if you've seen people who've drunk a lot of alcohol or have advanced liver disease, they have dysregulation in their hormones, and you'll notice men who drink a lot of alcohol tend to have, they have this hormone imbalance, so they tend to have some, boobs, gynecomastia. So that's really to show that the liver is no longer working well. The liver is an organ that has remarkable regeneration. It has 2 lobes, and when liver transplants are carried out, half of the recipient's liver is taken, given to the half of the donor's liver is taken, given to the recipient, where it grows to full size, actually, or up to 5%, and in the person who donated it, it also grows back to full size. So that's a very powerful organ that you absolutely cannot live without. This is an organ that has over 500 jobs, and processing your Friday night drink is just one of them. So we don't want you to make that the only job for your liver. Team YouTube, are we online? Good. So can the liver handle alcohol? Yes. But then I'm being told I might need to recap for YouTube, but I think I'll do that at the end. So can the liver handle alcohol? Yes, but then again, only up to a point. Tolerance, or your tolerance to alcohol in the liver, is affected by other factors, which I hope I'll cover in the next few slides. Damage in the liver would tend to build quietly. And then traditionally, you've heard that 14 units is the threshold, is the limit per week. And I think I want to try and demystify and answer some of the questions around how much should you really take, okay? I want you to remember, as we tackle this topic, that the liver processes alcohol at a fixed rate, okay? It cannot speed up. Even no matter how much you drink, the liver will take its time to process alcohol. It will not speed it up any faster than it already can. This is an important slide. I promise to keep this non-technical, but it's really important to discuss how alcohol is metabolized in the liver. It is impossible to explain to you why you get a hangover or toxicity without helping you understand what happens when you take alcohol. So alcohol, also known as ethanol, will be absorbed into your bloodstream and carried into the liver, where it will undergo a 2-step metabolism to break it down to a very simple product that can be excreted in the form of water and carbon dioxide, either in the urine, in your breath, or in your sweat. Now, the first step is ethanol or alcohol will be broken down to acetaldehyde by an enzyme called alcohol dehydrogenase. And then the second step is that this acetaldehyde will then be broken down further to acetate by a second enzyme called aldehyde dehydrogenase. Then further broken down, okay? So, once you have acetate, acetate is now easy to secrete. This is easy for the body to handle, okay? So, if you drink more than this, to get from this point to this end, for you to completely metabolize 1 unit of alcohol, it will take you at least an hour. So if you have more ethanol than your liver can manage, than these enzymes can manage, then you start to have buildup of either of these products. So either the ethanol will become more in the blood because it's not being broken down sufficiently, or the acetaldehyde will become more, or and usually it's these two, ethanol and acetaldehyde, that are toxic. Ethanol itself is directly toxic, but acetaldehyde is what gives you a hangover. When you wake up the next morning and you have a pounding headache and you're feeling nausea, that's because you have a lot of acetaldehyde in your system, meaning not all of it was converted adequately, and the only thing that works is time. All that must be converted to acetate for you to be able to excrete it. So it's not how much water you are drinking at that time, how much coffee you're drinking, how much you're peeing. It's how much capacity does your liver have to break it down from the point of acetaldehyde to acetate. Now, what are these factors that affect alcohol metabolism? Genetics. You will see families where when they drink alcohol, people in the family get cirrhosis, get sick, a lot of mortalities. Yet you will see people who will drink alcohol for years without anything ever happening to them. Our genetics are very different because we have different amounts of this alcohol dehydrogenase and acetaldehyde, these enzymes that are required to break down the liver. So these enzyme variations are what affect how well we metabolize alcohol. Our body weight and composition is also an important one, because now the body weight, if you have a very lean person, most of the time your capacity to metabolize alcohol is less. So you tend to have more alcohol in your blood compared to people who have a lot of weight. If you're older, again, your capacity to metabolize alcohol is less. If you're female, your capacity to metabolize alcohol is less because women generally have less of this enzyme. Remember I mentioned this enzyme, okay, alcohol dehydrogenase, less availability of this enzyme to metabolize alcohol. Another thing is the amount and frequency of drinking. If you're drinking daily, if you're drinking a lot, if you're drinking very quickly, I mean, not quickly, but a lot daily, then you're not giving your liver a break. So even when, instead of it recovering enough to be able to metabolize the alcohol, you're not giving that recovery time. Of course, there's medications and other liver conditions that affect how you metabolize alcohol. I want you to remember that acetaldehyde is toxic, so is the ethanol, contributes to liver inflammation, fat accumulation, and cell damage. Therefore, this excessive alcohol is what leads to the toxicity that we are going to cover later. Now, let's talk about blood alcohol levels. I think we all know that when we get that breathalyzer test, what do they look for? When we can check blood alcohol levels, either checking in the blood, we can check it in the breath, we can check it in hair, and we can check it in urine. But what does it really mean? So your blood alcohol levels is the grams of alcohol per 100 ml of blood. Okay, usually it is the degree of it is usually used to measure the degree of intoxication. This is a really important thing to understand because remember, all this ethanol is taken into the blood to the liver for metabolism, but if it exceeds the capacity of the liver to metabolize, it will be in your blood, and that is where it is measured from. Okay, for you to get this is an approximate for a 70 kilo man. Apologies for the units, I use the US reference, and that's why the units are in pounds. For a 70 kg male or 70 kg female, 4 shots of spirit, okay, or 4 glasses of wine, small glass, that's 125 ml, or 4 beers will result in 0.1% blood alcohol level, or 0.12 in females. So you can see it's more in females, and we've said that is because females have less water and less metabolizing enzyme. They have more fat, less water, and therefore they tend to have higher blood alcohol levels. What I'm really trying to help you understand in this slide is what blood alcohol level means, because that's what the police understands. That's the legal limit is 0.08. We know that once you hit certain limits, certain things happen. Let's go through that. Now, obviously at 0%, if you have no alcohol in your blood, nothing happens to you. By the time you are at 0.02, you start to become slow in your responses. By the time you are at 0.4, you have trouble distinguishing colors. They say this is when everybody at the bar starts to become beautiful. At 0.6, at 0.06, not 0.6, 0.06, you have trouble with balance and coordination. You are unable to stand up or walk. At 0.08, your judgment is significantly impaired, and you should not be driving at this amount when this amount is in your body. Again, this can be measured in your breath, in your urine, in your blood, from your hair. Those are the most important places. So remember, the legal limit for driving is 0.08. It's a very small amount, okay? But I mean, it's not small. It's relatively, it's a lot. But once you hit 0.3%, okay, that results in coma, and some people can actually die from that. That is risky. Okay, I hope we are together until there. You let me know if my slides are not showing or if you can't hear me. Vicky, I'm just confirming that you can still hear me.
They're showing, Doc. We can hear you.
Very good. Now, when is alcohol use harmful? Again, this is just repetition, and we'll talk about this many times. So this is when you're using it frequently. If you're binge drinking, and we'll define those units for you, if you have no rest days, and also if you have poor capability of these metabolizing enzymes, okay? Metabolism is not, if you're not able to metabolize, this ties in with your genetics, okay? So as we present this talk today, I want you all to realize that we really do not know your genetics. Genetics is a very powerful way for us in medicine to find out what risk you have. In liver medicine, we are taught that we must ask each person we see whether there is a history of liver cirrhosis in their family, whether there is a history of liver cancer, because it just shows that you have the same genetics in your first-degree relatives. And you see, this genetics helps us to actually advise you that you probably don't have capacity like other people in the general population. what is the damage that happens if you have a lot of alcohol in your system. You start with a fatty liver that can go on to give you hepatitis or inflammation in the liver and can go on to give you cirrhosis. I promise to keep this non-technical, and so I will not spend a lot of time in the non-technical bits. Warning signs are usually that you come with fatigue, jaundice or yellowness of the eyes, and swelling of your body. It can be your feet and your tummy as well, because you have water accumulation, fluid accumulation. But usually these signs are actually late. Most of the time you really don't feel anything until it's too late. Okay? Now, let's talk about our limits. Now, how do we know how much to drink? I mean, this is now the most interesting part of this talk. So now, there's a guide to alcohol units. Okay? Now, this guide that I'm presenting here, I want you to understand what a unit of alcohol is, so that you can choose how many units, so that you're able to calculate how much you're putting in and really be able to set for yourself your limits. This is how we start to know what our limits are. An alcohol unit is, in 1 unit of alcohol, 1 unit of alcohol has 10 grams of pure ethanol or pure alcohol. In some texts you will see 12 grams, but usually the standard is about 10 grams. And this is usually the amount that the liver can process in 1 hour. Please, let's understand that. In 1 hour, you are only able to process 1 unit of alcohol. So that in that 1 hour, if you take 3 or 4 units of alcohol, your body will completely not be able to manage that. And this one is just hinting at what is coming. Pace is everything. How fast are you drinking? Okay? How can you know how much alcohol units there are in your drink? So you take your drink volume in mLs, you multiply by the alcohol by volume. It's usually in a percent on the drink you're having, and you divide by 1,000. Let's take an example of a beer that is, let me say 4%, okay? So 4% alcohol by blood volume. So that's 4. Multiply by, let's say it's a 500 ml bottle of beer, and divide by 1,000. And that gives you how many units? For those who've been able to calculate? Yeah, well, I can't unmute anyone. So that gives you 2 units, roughly 2 units, okay? So an example here on the side here, I think this is what people will normally take. So 2 shots of whiskey is 4 units. So this is a double. 1 shot is a single, 2 shots is a double. I think you know the measurements. I think the bar uses 25 to 30 mLs in some bars, but 25 is what is standard for us, okay? 2 bottles of beer is roughly 4 units. Like I have calculated 1 bottle to be 2 units just now. So you can see that 2 bottles will be 2 units. 2 glasses of wine, and Mathew, this is the very small amount. You can, yeah, I'm sure you've seen sometimes there's a big glass and there's also the small glass. The small glass should be 125 mLs. That is 2 glasses of wine is 4 units. 1 liter of busa, there's really no way of calculating this. It's about 4 to 6 units. This is highly, highly variable. We classify changa with the spirits, we classify busa with the beers, usually about 4% to 5%. So you should be able to keep track of your units, and this really protects your overall liver health, because then you know how many units you're taking. Okay? If we can go on to the next, how then do we start to define our limits? Okay? So this is a daily intake guide for male and female. Okay? Now, if you're drinking, please help me mute whoever is talking. Vicky? Vicky, can you help me mute?
I'm trying to talk. A minute. I think it's done.
Are we okay? Okay. Now we are talking about your guide to drinking. This is like your cheat sheet. Okay. If you're female, so this is your risk level. Your intake, female, male. Remember, females, we have agreed that we have less capacity to metabolize and what action is needed. So if your daily intake is less than 1 unit per day as a female, or less than 2 units per day, then you need to screen annually. Meaning you should know your liver function tests annually. You should know, get an ultrasound annually to see the state of your liver. I will remind you again that 1 unit of alcohol is like half a beer, because 2 units is a whole beer. Of course, this is for the 500 ml beer. Sometimes the alcohol is packed lighter, because you know the 4% 330 ml, that should come to about 1.2 units. So that classifies you at a low risk level. Annual screening is needed. If you're starting to do more than 1.5 units as female or more than 3 units daily intake, this is considered at risk drinking, and you need to have an initial evaluation. This is called an Audit C test. It's a test that helps you to classify are you falling under the umbrella of alcoholism? Do you need addiction counseling? I mean, it sounds a bit judgy, but then it's important to try and really understand whether you're drinking. You're almost approaching hazardous drinking if you're doing this daily, okay? And then you need to calculate what we call a FIB-4 score. I'll explain this shortly. This is just calculated from a liver function test. So it's a blood test, which you can do, and you can calculate, and then I'll tell you what next, okay? If you're taking more than 3 units per day, daily intake, okay? Or more than 4 units daily and you're male, then I think you actually need to get specialist review and an addiction referral so that we can help you cut back, cut down. First of all, understand where you are with your liver and be able to cut back, hopefully. What is the definition of binge drinking? If you drink more than 4 to 5 units within 2 hours. I'll remind you that a double shot of whiskey is 2 units. A single beer is roughly, 500 ml beer is roughly 2 units. So you can kind of fit into that. Again, it is if you drink all this within 2 hours, and here what we are trying to tell you again is pacing yourself is everything. It's absolutely important to pace yourself. So how then do you know what your alcohol limit is? This is a very useful, I call it a three-step toolkit that will help you to self-check yourself, to know your liver score, and to decide what your risk is, and so you can manage your risk. Now, the first thing you want to ask yourself is how many standard drinks do you typically take on a typical day? And really be honest with yourself. Am I taking 5 beers? Am I taking 4 beers? Am I taking 2 beers? Am I doing this daily? Another very important question that we really underestimate is, has anyone in your life, someone close to you, maybe not even close to you, an employer, a friend, a child, a spouse, asked you to cut down in the past year? This is a really important question that we don't understand, because even in the DSM-4, DSM-5 classification of what alcoholism is, the most important is when it starts to impair on your social life. You're away from home, you're coming home smelling like a brewery. So some of those things, has anyone suggested to you? It's a really important step in assessing how much you're drinking. And it's usually a red flag to think about, okay, maybe I need to cut down, okay? That's first, you check your drink. Number 2, know your liver score. And this is the one thing people don't know. I mean, we can look very good on the outside, but we have fatty liver on the inside. So we really need to understand what our score is. So this is what I was calling, this is a FIB-4 score. FIB-4 score is calculated from your liver function tests, a blood test, and also your full hemogram. These are just blood tests that can be done. It's a simple calculation that anybody can do, not just for doctors. And it will usually gives you a risk, whether you are low risk, intermediate risk, or high risk, okay? So if you're low risk, intermediate, or high risk. If you're low risk, your score should come to less than 1.3. And this is, safe. At this point, we are telling you, you know what? Your liver is okay. So just get checked once a year. If your FIB-4 falls between 1.3 and 2.67, this is your liver function test. You're intermediate risk, and at this, you're heading towards the, what we call the danger zone, and cutting down makes a huge difference to this particular cohort. If you have already hit more than 2.67, okay, and at this point, we can recommend another test called a fibroscan, and if you are really hitting more than this, here we will be recommending abstinence, okay? Now, if you fall in any of these categories, this is what we call the zero limit list. You absolutely should not take any alcohol. Okay? So if you've had prior decompensation, this means you had fluid in your tummy, you've bled before from alcohol, from vomiting blood. You have cirrhosis, you've had hepatitis, you have been admitted for any reason related to alcohol. You have any other liver disease, like you have a fatty liver, and you have with fibrosis, not just a fatty, but fatty liver with fibrosis, or you have viral hepatitis, or you're on other hepatotoxic medications, which we should be able to advise you, then this is a zero limit list, because at this point, when you're on this end, then your capacity to metabolize is much, it's less compared to most people, okay? You have already other things that are putting you at risk of progressing in your liver. And this is the no alcohol list. If you're on this list, no alcohol is safe for you. If you're on this list, we can negotiate. We can tell you, okay, maybe just moderate, cut down, you know. The good news, probably the only good news in this talk, is that it is reversible, okay? Any liver damage is reversible. Remember, I began by telling you about the immense regenerative capacity of the liver. And so if it is reversible, if you find it early cirrhosis, the alcohol is very forgiving. It will be reversible, and you'll be able to recover a good amount of function. If you don't recover 100%, 85%, so abstinence is really important, and the liver heals. There have actually been situations where people have been told your liver has failed, you're on a transplant waiting list, and in a few lucky people, once they get off the alcohol and they lay off the alcohol, they're lucky enough to actually recompensate enough to not require the transplant, although they would still require close follow-up, so they don't decompensate. Some practical tips, if you could absolutely have to drink, is to alternate alcohol with water. Remember, I have mentioned that you need to space and pace yourself, okay? Space it out, because you can only metabolize with 1 unit in 1 hour. Know your personal limits. This means you really must know what else you have that would limit you in taking alcohol. So this is not, there's no one script fits all. The units, they're just suggestive, but they're not for everybody. So you must know your FIB-4 score before you decide how much is enough for you. Avoiding binge drinking is the most important thing. Really, it has to be paced out. Don't overdo it. It gives you a lot of damage, even if you do it once a week. Okay? And then avoid drinking on an empty stomach. Food slows down the absorption of alcohol, and that helps. Okay? I would like to go on now and bust a few myths about alcohol. Sometimes people think that only homeless people, old drunks get liver disease, but liver disease can affect everyone, okay? It will most often be silent, it will be sneaky, and it will advance without symptoms. By the time you're seeing symptoms, it's a bit late. We know that 70% of people who have alcohol-related damage, this is what we see in hospital, are functioning professionals, okay? High-performing professionals who, have other hidden risks. Maybe they're sitting down for many hours. Maybe they have a fatty liver on top of it. And so it's important to get checked. Like I said, you can look very good on the outside and feel great, but you can have a fatty liver on the inside. Your liver does not have nerve endings. It doesn't scream. Your liver is not like your foot, which if I step on you, you will feel pain and you will move your foot. It will continue to work because the factory will not stop doing all the other jobs. Again, I am reminding you that you have 500 plus functions. Please don't make all this, your liver, just about metabolizing alcohol. Make sure it is having enough space to do everything else it's required to do. Other myths, okay, versus new science. I want to bust a few myths. These are some of the questions I've been asked before. Okay, sometimes you say, okay, I don't drink every day, so I'm fine. Partially true, but then it's the total units per week that matter. If you, on the day you drink, you binge, then you're really not helping yourself. You need to think about the total units per week and not just that you're avoiding a hangover. Some people say a bottle of wine is just 2 glasses. It's not a lot, but a bottle of wine is actually 10 units. So now this here is me teaching you that you really want to know the units of alcohol. Okay, alcohol is alcohol. It doesn't matter what it is, whether it's more expensive or cheaper, alcohol is alcohol, okay? There's a myth that coffee sobers you up, and I'll just detox with juice tomorrow. That does not actually happen. There is no shortcut to detoxification. It's only time that will heal the liver and allow you to clear and metabolize the alcohol. There's also a myth that the antioxidants in the wine will cancel out the alcohol. The antioxidant in wine, I think the antioxidant in grapes is called resveratrol or something like that. I think you will have to drink probably 40 bottles of wine for you to get enough amount of resveratrol that you would be getting in a handful of grapes. So really go on and eat the grapes, don't drink the barrel. So don't imagine that it helps you with antioxidant. There are many other ways to get these antioxidants, and alcohol isn't the way to do it. I am encouraging us to build healthy habits, including alcohol-free days, embracing exercise and diet, keeping ourselves preoccupied with other hobbies so that we have many alcohol-free days. And I think I have a nice slide on that. Okay, I want to remind you to give your liver a break because alcohol puts it under strain. How do we do that? This is what I call the party saver strategies for World Liver Day, Liver Week, and beyond. Okay? I'm inviting you all to be the smartest person at the bar through spacing and pacing yourself. One alcoholic drink, then one soft drink. One alcoholic drink, then one soft drink. Some people suggest that a sparkling water will still look fancy enough, like a gin and tonic. So maybe opt for that, okay? And then there's also a 3-day rule, okay? Where you give your liver 3 consecutive days of alcohol every single week. And that is a fantastic time to regenerate, to recover, okay? Can take Monday, Tuesday, Wednesday off, entirely up to you, okay? And also the eating hack, never drink on an empty stomach. And I think we all know this because that food is a speed bump for alcohol. But remember, space and pace yourself and give yourself breaks from alcohol. This is a very useful tool. I find I encourage my patients who feel like they want help, some digital help in cutting down. It's a personalized digital therapy tool that helps you to achieve and sustain alcohol abstinence. It helps you count the number of days. It helps you, gives you ideas on what to do when you're craving. And it also helps you with a quick calculation of the units of alcohol. So this is a really, really helpful tool. I think if you are feeling like you're on the risky, higher end of hazardous drinking, then you can actually use that. I want to tell you all today that there's no completely safe level of alcohol. Less is better, and that your liver works 24 hours, 7 days a week, so you need to protect it. What you need to do is enjoy responsibly and know your limits, and this is personalized. Like I've mentioned, sometimes your limits are not the same as someone else's because in your family there's a genetic predisposition to liver cancer. That's a sign that you need to probably cut down. So I want you also to remember that a healthier liver means a longer life, okay? Early detection saves lives. If you don't know your FIB4 score today, this is an opportunity to go and get it checked, get an ultrasound of the liver. Everything you do, every brick counts. You need to catch liver disease before it's too late through regular checkup, okay? And catching the damage early when you can still reverse it, okay? Oak Tree Center would be providing a vitality health package related to the liver for the whole entire liver week. We do this every year, and we are happy to screen you even if it's just that time of the year when you want to check what's happening with your liver. This would be a good opportunity. Now, this is a summary of everything I've talked about. In case you joined in late, in case you missed this, in case you're on YouTube and you came in late because we set up late, this has been a talk about alcohol and the liver and teaching you about your limits, okay? I have mentioned that your liver is your lifeline. It works 24/7 and has very major functions, okay? That it does more than 500 functions. A very small function of this is detoxification, but we are trying to remind you not to give your liver most of the work. One example I meant to use here is if you have a very busy supermarket with a lot of cashiers, okay? And then there's a spill somewhere in the back end, maybe in the bathroom, and you remove all your cashiers to go and clean the spill because that spill is too busy. And then you leave your supermarket counters unattended and people are still coming in to shop. Imagine the chaos that be there. That's what happens when you distract your liver to make it metabolize alcohol instead of doing the other important things, okay? Like breaking down your food, protecting you from illness, and aiding in your digestion. Alcohol affects your liver through giving you initially a fatty liver, then hepatitis, and then scarring, which most of the time you come to hospital, it will be too late. Some of the limits that we are advising you, a maximum of 2 standard drinks per day for men and 1 standard drink per day for women. Again, if you know your other risk factors, okay? Remember to allow yourself 2 alcohol-free days per week. I had said 3 before because I was trying to push you to go a bit longer. If you can go 3 days, that's fantastic. To give your liver time to recover. 1 standard drink is equivalent to 1 beer, 1 glass of wine, 1 shot of spirit, okay? So try and understand what a unit is and how much you should be what is safe for you, okay? Avoid binge drinking. And then some of the signs that it's time to cut back. Are you tired all the time? Are you feeling bloating or stomach pain? Are your eyes beginning to turn yellow? Dark urine or pale stool? Unexplained weight loss or any mood changes or anxiety? I think it's time, when you get there, it's time to come to hospital. I think I've taken about 40 minutes to allow for an interactive session. I'll be taking any questions now. Thank you. Back to you, moderator. Mathew or Vicky?
Thank you, Dr. That was quite a presentation. I think for us laymen, we now understand. We can have a drink at Monday, then, or not Monday, Thursday, and then give it a rest. The floor is open for any questions. I think let's have some order. Maybe if someone would like to ask a question, we can ask in the chat box or raise a hand, and then we can proceed. Maybe there's one I've seen on YouTube live. As we wait for the other questions.
Okay.
Does body weight or gender affect how much alcohol is safe?
Yes. Yes, it does. I'm going to try and get back to that slide. I don't know whether you can still see my slides. Yes, it absolutely does. Alcohol, I mean, what was the question? Was it gender and body weight? So less body weight means you metabolize less. Females have less capacity to metabolize. And that is why in the units that we're saying men can take 2 units per day, women only 1 per day. That's the RIFE guidelines, okay? So definitely affects how much alcohol you can take, meaning women should take less.
Noted. I'm seeing something in for chat. How many units of alcohol are in Muratina?
Yes, good question. I had it on a slide, but I felt like it was very busy. I felt like it was taking away from the main. Muratina is classified with the beers. It should be about 4%, 4 to 5%, depending on how strong that Muratina is. About 4 to 5%. So we classify it with the beers. Muratina, Busa are with the beers, Chang'ai is with the spirits. The spirits are 40%. Let me see if I don't know if I have that somewhere. Good question. Other questions? The Ugandan Waraji is a bit stronger. I think I have seen before other texts saying 5 to 6%, so roughly. So Muratina falls here with the beer.
Okay, great. I'm seeing someone asking, Samsung SM, asking what happens when during drinking, palms sweats a lot. Does it mean the liver is getting to a dangerous level?
That's a very good question, and I actually have to take you back to a slide. I don't know whether, if you can't see my slides, I'm just going to explain what I was talking about. You see, when I talked about the liver, the functions of the liver, one of the functions of the liver as a manufacturing powerhouse include regulation of hormones, okay? We know that people, and it usually comes to what it does in the metabolism. If you interfere with the liver function and you have the interference with the hormones, most people will get sweaty palms or red palms. So yes, it's actually a sign sometimes that you're really straining or stressing that liver.
Right. Maybe I'll go back to YouTube a little bit. Someone is asking or requesting whether we can get the slides that Dr. Karoney is using to present.
Yes, we can. We'll do flyers. We'll do summary flyers, just 2 or 3 simple things to remember.
Sure. Rebecca Kipego from our chat says, good presentation. Really appreciate your services. You've done great to liver patients.
Thank you.
Odorian is saying, if I take my weekly limits on one day of the week, how does it translate on the risk?
Brilliant question. That's a binge. Okay? We talked about binge. It's about time. You really have to pace yourself. You cannot drink everything at the same time at once. Okay? I have a small audience with me and they have laughed when they heard that because I think this is what most people practice. They save all the drinking to the weekend and then they drink all of it at once. That damages your liver. Binges really damage your liver. Space and pace. That is a good party trick. Let me go back to that slide for those who can see the slides.
Maybe as we are going back to the slides, I'm seeing here, can a patient with DM take whiskey? There's something else I think close to that as well. your comment on drinking alcohol by people who are maybe diabetic patients. I think that's what they meant.
Okay, that's a good question. And again, the same rules apply to everyone. So remember, we have said, know your risk. Knowing your risk is how you know your limits, okay? Let me see, where is this? Yes. So if you are diabetic, you see you're not excluded from this. Checking your drinks, what is your liver score? And then answer that question based on your liver score. Okay? Of course, obviously think about your genetic risk, because most of the time, if you're diabetic, poorly controlled, you probably have a fatty liver already. And if your fibrosis score, if you're falling anywhere in intermediate risk, it is really a good time to cut down, because what will happen is fatty liver will accelerate your risk. It just accelerates your risk and your progression to liver cirrhosis. It is thought that the light, I shouldn't mention anything by brand, but the light beers are actually meant to be low calorie, not less alcohol percent. Just so you know, it's about how much calories is in the beer, not really that it is less units. So you still need to be able to objectively think about the units of alcohol that you're taking. Yeah. So this still applies. Know what is your liver score, and then take your decision based on that.
From maybe YouTube, I'm seeing someone is saying, ideal gospel for alcoholics. The Bible won't do any good than this. So maybe you've touched somebody. What is the risk of cocktail drinking of various brands of alcohol?
I like that question, because people think that it's the cocktails that make you drunk faster. It is strictly the amount of alcohol inside that cocktail. Is it a double shot? So you still must be very objective. It's not about the chaser or whatever you've added to the cocktail. How much? Is it, they put 2 shots of rum, so you still must remain objective, that the amount of alcohol, pure alcohol itself, is what matters as to your risk, so that you can't say, wine is better, cocktails are better. I don't know if I'm answering that question. Yeah, because if you're taking cocktails and you're taking 2 cocktails and each cocktail has two shots of rum, then you're doing 40%, 4 units, that's 8 units of alcohol, which is the same as 4 beers. So I think you really have to just think about it. I don't know, I hope it answers this. Whoever is not satisfied can ask me again, I'm happy to answer that question again. I do see that we're running out of time.
Yes. Maybe what we can do, we can see if we can collect some of the questions, then we can have an easy, maybe answer a session, maybe on YouTube another time, if you'll not be very busy.
No, I'm happy to do that. I'm happy to accommodate this. Please, like I said, in my practice, it's very stressful, frustrating to see people who are coming to you at end-stage liver disease. I mean, this prevention is everything. I really can't emphasize how important this is. Knowing what your liver status is now is better than waiting until we have... Remember, in this country, we don't have a transplant program. It will take us a lot to actually build the infrastructure and the personnel. And we are here, we are willing to help you, but it's still a different kind of life. If it is possible to allow that liver to grow back, to regenerate, to recover its capacity, that would be ideal. And that is why this talk, I'm very passionate about this talk, because I feel like we can do a lot more through prevention. Okay?
Thank you, Dr. I think time is almost over. Thank you for all the questions. Dr. There's a question here now. Does drinking with heavy meals help reduce the lethality? And also this is tied in with, does the choice of chaser matter, water or soda?
Okay. Let me see if I can answer. The first question was, does drinking with heavy meals... Drinking helps you, with meals, helps you to absorb less. Absorb less alcohol, so it helps a bit. But it doesn't reduce lethality, it just helps you absorb less of the blood alcohol. So yeah, it does. It helps to feed fast, okay? The choice of chaser does not matter, okay? unless you're taking the chaser in between. You know, you're taking the water separate and then the alcohol. It's not that mixing it makes you don't dilute the alcohol, if that's what you're asking. You have to be objective about how many units there are. I saw a question about a limited amount of wine or whiskey reduce cardiovascular risk. And this was my point about resveratrol, the amount of antioxidant in alcohol. What you can get from a handful of grapes, you will need to take about 40 or so bottles of wine to get that. So like I said, don't drink the barrel, eat the grapes. That was an answer to one James.
Yes, Marina James. Okay, maybe I can just allow Dr. Koech maybe to say a word.
Yes, as I am also, okay. So.
Yes. Dr. Mathew? Dr. Mercy, any maybe closing remarks? Just let the medical practitioners know that there's a Google form for you that has been submitted on the chat box for you to fill in for your CPD points.
Okay.
And I think for everybody else, yes. Karibu Daktari for maybe a word as we end.
Oh, yeah. So thank you very much. Thank you very much, Dr. Karoney, for the excellent talk. I think we've really learned a lot from you, and I'm sure the crowds that has been listening in on Zoom as well as YouTube has really benefited from your insights. We don't take it for granted that you took your time this afternoon to prepare the talk and to give the talk, and for us, we really are grateful for that. Thank you, Vicky, for organizing this on behalf of Oaktree. And thank you, all the doctors and all the clinicians who've attended, including the medical students who've attended. We really thank all of you for coming this afternoon or this evening for this talk. Thank you, and good evening. Vicky, back to you.
Thank you, Dr. Dr. Karoney, any last words as we end the meeting?
I just wanted to add a thank you to all the the categories Mathew has mentioned. I think Mathew had talked about the doctors, but this was for the general population. I really feel like it's about time we took our CMEs away from the doctors and took it to the people who are affected most, who need to know this information, because we will be more impactful. And I want to sincerely thank you all and encourage you to make the small choices today that will make a big difference tomorrow. Thank you.
Thank you so much, Daktari. And I think without further ado, we can call it an evening. Thank you all for joining, and have a good night.
Thank you so much.
Thank you. Bye.
Say that again.
Just do like for the YouTube guys.
Sure.
Just
A takeaway. Yeah. Happy to do that. So. Let me know when I can start. So just a takeaway, take-home message from the talk today. The talk today was about alcohol and the liver and knowing your limits. I want to remind everyone out there that your liver is your lifeline. It is a very powerful organ that does so much, over 500 vital jobs, one very small one of which includes detoxifying alcohol. And so we are here to encourage you not to make that its only function. Alcohol, when taken in excess of what you can handle, will make your liver progress from fatty liver to hepatitis and on to cirrhosis. I'm encouraging each and every one of us to know our limits within context of our own genetics, our gender, male or female, our age, but we can only be very well informed if we check a liver function tests, get a calculation of something which is called a FIB4 score, which helps us to place us in what risk we have. And then from that point, we can make a decision, an informed decision as to how much, alcohol we should be taking. Obviously, taking in moderation. The message today has been that less is more. Less reducing alcohol gives your liver time to recover. I also want to insist that no amount of alcohol is safe. However, if you absolutely have to take, know your risk, and that's the only way you can define your limits. Thank you. Thank you and have a good evening.